So let's look into the side effects of one of the newer antibody drug conjugate that is approved in breast cancer, which is Datopotamab Deruxtecan, or we call it as Dato-DXd. So Dato-DXd is an antibody drug conjugate which is very recently approved on January 17 of this year. And this particular antibody drug conjugate is approved to use in breast cancer because it is specifically designed to go and target TROP2 antigen or TROP2 agent that is seen in the breast cancer. Here also the agent that they are targeting is TROP2, which is similar to the other antibody drug conjugate sacituzumab govitecan. Let's look into the common side effects of Dato-DXd. The most common side effect that can happen with Dato-DXd is mucositis, which means inflammation of the mucosa of your mouth or your entire gastrointestinal tract. So sometimes it just happens in the mouth, so we call it as stomatitis, or sometimes it happens to the entire gastrointestinal tract. Most of the time, the mucositis is always present as an inflammation or a red color inside your mouth, or sometimes in several conditions, it can present as mouth ulcers, or it can present as ulcers anywhere in your gastrointestinal tract, including your mouth, your esophagus, or even your stomach. And you may be having difficulty and pain when you swallow the food and when the food is getting digested, and that's how you report that to your provider. So the main treatments that we give for the stomatitis or the mouth sores that happens with Dato-DXd is ice chips or ice water. We ask patients to take ice chips or ice water when they actually get the medicine Dato-DXd. Or if they have pain in the mouth, we'll be giving them lidocaine mouthwashes, which is an anesthetic mouthwash. Or if they have the severe mucositis with several ulcers in the mouth, we will be giving them steroid mouthwash, along with the pain medications that we can use to help with the pain that happens from the mucositis. And one of the other finding or one of the other side effect that can happen with Dato-DXd is eye problems. Sometimes the patients may be presenting with dry eyes, or sometimes they can have ulcers in the cornea, similar to what you see in this picture. You can see that in this picture, inside your eye, there is a white spot here. So this is how usually corneal ulcers present, and which is a serious side effect from Dato-DXd. Or sometimes you may be just having pink eye or conjunctivitis. So if you are experiencing any of these side effects related to your eyes, when you get the medicine Dato-DXd, call your provider immediately, as it can lead to severe side effects including blindness. And the other problems that you can see with Dato-DXd is interstitial lung disease, which we mentioned in the prior slides. So the main treatment that we give for the eye problems that you see with Dato-DXd are avoid contact lenses if you're using that, and we will be prescribing lubricating eye drops. And in severe cases, again, we will be holding the medicine or dose reducing the medicine, or we will be even discontinuing the treatment. So those are the main side effects that can happen with the antibody drug conjugates, especially with the antibody drug conjugates, those that are seen in breast cancer treatment. So what are the things that you need to be mindful when you are getting antibody drug conjugates? Always ask your provider, is this the right treatment for me? Am I the right patient to get this treatment? That's the main thing that you and your provider need to discuss. Always ask, what are the side effects that can be seen with this antibody drug conjugate? So if you know about the side effects, then you can prepare yourself to identify the side effects at the right time, so that you can monitor the side effects and you can follow up with your provider and you can get prompt treatment at the right time, which can prevent the progression of the side effects, and it can also help with your quality of life. Thank you so much for listening.